Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Thursday, January the 21st, 2021. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Vilna, Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto City Councillor and Chair of the Board of Health, Joe Cressy. Mr. Mayor?
Well, Brad, thank you and good afternoon. May I, before I begin my remarks, say two things that are somewhat unrelated, but although one is partially related to COVID, and that is, first of all, the man who's been to my left for so many of these media avails has been named, and we're so proud of this at the City of Toronto, the Fire Chief of the Year by the Association of Fire Chiefs of Ontario. And I think for those who are watching, for anybody from Toronto to win anything that is voted upon by people from other parts of the province is a mean and extraordinary feat. You know, I've seen him in action as a fire chief and know that he's the best of the best, but we've also seen much more than that in terms of the management role that he's taken on in helping us and leading us in managing this pandemic. And I just want to say that the recognition as a fire chief is extremely well deserved, and it goes much further than that. I will have, there'll be a chapter in my book that will say more than a fire chief, and it'll go on and on for pages about the role that he's played in all of this. So congratulations, Chief. Thank you. I also want to acknowledge that today is Lincoln Alexander Day in our city, and that's a very important day in our city and in our province. It's a day when we recognize and celebrate Lincoln Alexander, and it was somebody who was well known to me from a very young age. He was a person who showed leadership and determination in the fight against racism and discrimination, the likes of which we haven't seen in too many places in our city and in our province historically. He was Canada's first black member of parliament. He was the first black Canadian to serve in the federal cabinet. He was the first black Canadian appointed to serve as lieutenant governor of this province. But regardless of what title he had, and sometimes he had no title other than former this or former that or first of this or first of that, he never lost his determined but yet a very sort of gracious way of being a fighter against discrimination and racism. And he was somebody who set an example that we should all follow, and that is why we honor him on Lincoln Alexander Day. He was somebody that left a powerful legacy, and it's something that is worthy of recognition every day, let alone just today. There's no doubt that COVID-19 is impacting the lives of every single resident of Toronto without exception. But we also know that COVID-19 has had a bigger impact on some neighborhoods and communities and some people in our city more so than others. COVID is a risk to all of us, but we know it has impacted lower income residents and people from diverse communities to a greater extent than it has other people. And that is why, in addition to our universal services offered to everyone across the city, COVID or not, we have implemented targeted equity measures to support neighborhoods experiencing higher COVID-19 case rates. We've not just done that because it's where there's a more acute problem facing us in terms of public health, but we've done it because it was the right thing to do. And I wanted to update, as will Councillor Cressy, update you on some of our efforts thus far. Our goal was to reduce the number of cases and get to the bottom of why there are higher case counts in some areas as opposed to others. We identified major tactics, including a focus on expanded testing sites, increasing education and engagement, and advocating for residents who test positive for COVID-19 and were thus unable to work because of the requirement for mandatory isolation. Since the rollout of the enhanced plan, the city and its partners have been able to engage with more than 7,266 seniors, 18,900 adults between the ages of 30 and 64, 5,900 youth between the ages of 15 to 29, and 5,300 children. And I want to highlight the excellent work in particular being done by Toronto Community Housing as a partner in these targeted initiatives. TCHC has been working hard to support the wide variety of needs of its tenants and their individual needs. Since April of 2020, to help identify positive cases in TCHC buildings, TCHC, with the help of Toronto Public Health and regional health and social service providers, have conducted 5 door-to-door COVID-19 testing initiatives. And these are, as they might suggest, this program specifically targeted TCHC seniors housing buildings to help tenants who are vulnerable or isolated. And doors were quite literally knocked on by people who could then engage with these seniors. The most recent initiative occurred last week, where approximately 220 residents were actually tested in North York as a result of being encouraged to do so by this broader engagement initiative. To date, approximately 1,386 senior residents in TCHC buildings have accessed on-site, mobile, or door-to-door testing, all ways of taking the testing to the people, to the seniors, as opposed to necessarily expecting that they would find their way to the testing. Beyond that, TCHC also did more than 19,000 wellness checks on vulnerable tenants and seniors by telephone and by door knocking. I'm pleased to say that they've begun a second round of these wellness checks this month. This is the level of care that some of these residents need. It is certainly the level of diligence that they deserve right now. And it means that we can better support those who are more vulnerable and most impacted upon by this pandemic. And it means we can often catch COVID-19 before it spreads. These are remarkable numbers and stories, but it shows the high need for these types of services across the city, and I'm glad that our city staff, the Board of Health, our Medical Officer of Health, and all of us on this team have been committed from the beginning to trying to innovate in this manner to make sure that we can reach people and help deal with them effectively. And that is why we are continuing to do our work in these communities. We are hopeful, to be candid, that our modest funding request to other governments to help us finance these initiatives will soon be responded to in the positive. Working with our community partners, we're improving access by simply bringing testing closer to where people live. Approximately 271 testing clinics have been booked in more than 20 different Toronto parks, forestry, and recreation sites. 89 testing dates have or will be undertaken over the month of January at 12 city-owned locations, many of them parks and recreation facilities. And community pop-up and mobile testing supported by Toronto Paramedic Services and the city's healthcare partners continue into the weekend. Although we can test more people via bricks and mortar testing sites, the mobile testing has helped us to get to hard-to-reach individuals and hard-to-reach areas in the city, where there may be different reasons for people not finding access to or being reluctant to access testing. On top of testing, a big part of our approach includes education, outreach, and engagement, especially among newcomer populations. And this has included referring approximately 1,283 residents to multiple support services or agencies, redesigning and translating resources, different materials of ours into 30 different languages and sharing them with our community health partners, referring more than 16,500 residents to food access supports, such as food banks or the Red Cross Food Hamper Program, and providing integrated and culturally sensitive mental health support to more than 7,000 residents through the community partners we have worked with throughout the pandemic. I want to share a couple of examples, because oftentimes when we give those numbers and talk about partners and so on, people are still not exactly sure of what supports are provided to people. An example of engagement work taking place includes several agencies such as the Black Creek Community Health Centre, the Davenport Perth Neighbourhood and Community Health Centre, and Malvern Family Resource Centre, who have hired young people to develop programs to reach other young people who are having COVID-related difficulties in their lives. This is a group we don't want to overlook during the pandemic, especially if you look at some of the history of how infection rates have increased in that group over the period of the pandemic. And it's a group that are facing some other very unique challenges within their families, oftentimes in our communities. These programs will help them get the help they need in order to deal with those things, whether it's their own personal health or the health and circumstances of their families. Another example includes the work being done by Black Creek Community Health Centre, Taibu Community Health Centre, and Unison Health and Community Services, who've set up COVID-related non-crisis hotlines. These calls fall far below the emergency bar. We don't want those people to call 911, and 311 may not be exactly what they require, but it often involves a level of desperation that needs immediate response. And we know there's more work to be done, and we will continue to do everything we possibly can. But these are examples, again, of calls that might otherwise not meet any particular threshold, but the people clearly do need some degree of support during the pandemic. COVID-19 has made many aspects of city life go virtual. We all know that. Many people who are working from home are doing it over the internet. In my own case, I mean, my days have gone from days where I'm out at events in the city quite a lot, listening to people's stories, seeing things that I should see as mayor, and in meetings that I held inside the office, to now almost exclusively events that are held over WebEx or Zoom. A lot of these kinds have shifted. And this has made access to the internet more vital than ever. And that, of course, includes the total internet capacity needed to properly serve, for example, the significantly increased requirements of a family of 4, where you might have, within one living place, 2 adult income earners working from home because they're being encouraged to do so, and in some cases have been required to do so, and 2 children who are required to use the internet for virtual learning, as most are required to do at the moment. This has, drawn into stark relief the fact that we have a need for more people in the city to have access to reliable and affordable internet, which certainly it's the case that not everybody does have that. So we need to work with community and private sector partners to make sure that no one is left out of affordable and reliable internet access, and to eliminate barriers between people and the information they need to stay safe and to stay healthy and to be included. To be included in a number of different respects, I think we all understand, economically, socially, and otherwise. In a report going to the Executive Committee next week, the City of Toronto is introducing Connect-TO. This is an initiative that I hope will become very big over time. It's going to start modestly as we prove the concept out, but it's a program that will identify ways in which we can expand access to affordable, high-speed internet using city resources and assets, sometimes on their own, and more often in partnership with others that are in the same area or in the same business. This program will allow us to create a citywide high-speed internet network which will deliver service to underserved homes in particular and businesses, usually in a partnership with others. Access to this high-speed network would be offered to qualified service providers at a fair price to generate revenue, which will be reinvested back into communities to expand service with areas without adequate access to help put in place, and this will help put in place lower internet costs for vulnerable Torontonians especially. People may not know, but we have fiber networks, the fiber optics over which a lot of these data travel that are in place because of Toronto Transportation Services, TTC, the police, different aspects of city government, and they are underutilized at the moment for this kind of purpose and could be put to work, and we're going to put them to work in 3 areas on a demonstration basis: Jane and Finch, the Golden Mile, and Malvern. And these are all areas where we have reason to believe, based on some of the studies that have been done, that people don't have the kind of access they need to the kind of internet service they often need in the circumstances I described. Subject to council approval, service to sites in these areas would be expected to be live on this demonstration project basis later this year. This is the right thing to do, and there's no better time than right now to move forward with an initiative like this that, as I say, I hope becomes much bigger once we've proven out the concept. An equitable and digitally connected Toronto means everyone can participate in our success story, which will go from strength that we had before the pandemic to strength that we have after the pandemic in short order if we do things right. I'm very proud of the work that went into the development of this program and eager to see it come to fruition, and I would expect that I will have more to say about how we can try to help make that happen faster in the coming weeks. Now it's time to ask Dr. Davila to deliver her report.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 986 cases of COVID-19. 474 people are in hospital, 116 are in the ICU, and I'm sorry to have to tell you that 10 more people have died. I also want to focus today on a particular aspect of COVID-19 spread that relates to the equity plan and actions discussed just now by the Mayor and in a moment by Councillor Joe Cressy, the Chair of the Board of Health. As part of case management follow-up, Toronto Public Health is able to gather data that includes ethno-racial identity and household income. The most recent data up to November 30th, 2020 captured a distinct change in reported infection rates. These data show that in November, South Asian and Indo-Caribbean people experienced a disproportionately high increase in the reported infection rate. South Asian and Indo-Caribbean people had the highest case rate of all ethno-racial groups. This was 3.8 times higher than the rest of the population. South Asian and Indo-Caribbean people now make up the highest proportion of cases amongst ethno-racial groups overall, at 27% of cases, while comprising 13% of the population. As of November 30th, 2020, 79% of reported COVID-19 cases were in people who identified as coming from a racialized group. Additionally, 49% of cases were amongst people living in lower-income households. Racialized groups are also overrepresented in hospitalizations, as shown in our November data, which includes figures characterizing hospitalizations for the first time. 71% of people who were hospitalized with COVID-19 identified as part of a racialized group. This overrepresentation is consistent with the higher overall case rates in these groups. It does not suggest racialized groups are more likely to become hospitalized if infected. Like racialized people, people living in lower-income households continue to be overrepresented in Toronto's COVID-19 cases. Lower-income groups are more likely to be hospitalized due to COVID-19. People living in households with an annual income of less than $30,000 per year are 1.9 times as likely to have a reported COVID-19 case, but 2.7 times as likely to be hospitalized for COVID-19 compared to the rest of the population. So while COVID-19 is a threat to everyone, it is plainly imposing real and disproportionate burdens on racialized communities and lower-income groups. It is important to acknowledge how people's living and working conditions are contributing to these inequities. Evidence shows that racialized and immigrant communities are more likely to work in frontline and essential work, like healthcare and supportive services, putting them at higher risk for COVID-19. Many workers in lower-wage frontline jobs do not get paid if they call in sick. This is a significant barrier to our pandemic management efforts and reinforces the need for effective income supports for working people suffering from COVID-19, in particular, paid sick days. But any measure that makes it easier for people to remain safely in employment during the pandemic or to stay home and apart from others when sick benefits them and everyone else. It is, in my view, an investment with the capacity to generate significant returns in many ways. I also want to report to you today that for the first time in many months, Toronto's effective reproductive number is below 1, at 0.86. This means that overall, each new case of COVID-19 is resulting in less than one additional new infection. Practically speaking, it means that we have a slight advantage over the virus, rather than the virus having the advantage over us. Additionally, there has been a further decline in the 7-day new case moving average, which is now at 730, down from 772 at last report. This said, we need to see a consistent pattern of improving indicators before we call it a trend with any kind of confidence. Of course, lower infection rates and lower case counts are what everyone hopes to see. But it is very early going and a very delicate balance. the tide has not yet turned. Staying home, limiting our interaction with people we don't live with, and keeping a safe and masked distance when we are in circumstances where that's not possible. All this remains as vital as ever. These indicators are, I hope, an incentive for all of us to redouble our focus on the self-protections that strengthen us all. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. Today is the 317th day of continuous Emergency Operations Center operations. Our EOC continues to operate, ensuring that both critical and essential services are being provided without interruption. I'm proud of every member of our team who continues to work hard each day in support of our residents. From the outset of COVID-19, our overarching incident management system priorities have remained unchanged: to save lives and prevent the spread of COVID-19 in our city, and to prevent our healthcare system from becoming overwhelmed. These priorities continue to guide all that we do in planning for and responding to COVID-19. At present, our personal protective equipment levels remain stable, and our team continues to work hard to maintain an inventory of the equipment we need each day. Based on current consumption rates, our PPE inventory levels are as follows: a 281-day supply of N95 respirators, a 1,907-day supply of surgical masks, a 102-day supply of isolation gowns, a 573-day supply of face shields, and between a 117 and 663-day supply of disposable gloves, depending on the specific model. And as you can appreciate, we require a number of sizes and styles of gloves to meet the variety of needs on the front line. At present, our emergency PPE reserve includes a further inventory of both N95 respirators and surgical masks. Based on current consumption rates, our emergency PPE reserve inventory levels are as follows: a 1,782-day supply of N95 respirators and a 2,535-day supply of surgical masks. Our emergency PPE reserve is maintained for use in the event that we are unable to maintain normal operating inventories. The Province of Ontario provides the PPE required in order to operate COVID-19 immunization clinics, preventing the need for the City of Toronto to draw these items from our operating inventories. The enforcement of public health-related regulations continues to be a top priority for the City of Toronto since the outset of COVID-19. Our coordinated enforcement teams have been working diligently to enforce the regulations relating to COVID-19. The City has taken formal enforcement action 1,991 times to date. Since our last update, and as a result of violations of the Reopening Ontario Act, 6 charges were laid and 45 notices were issued against owners and operators of retail stores, personal service settings, and an automobile detailing service. Additionally, 9 charges were laid as a result of large gatherings on private property and in private residences. I thank the vast majority of residents and businesses who continue to help stop the spread of COVID-19 in our city. We also remind residents that when using parks, to practice physical distancing and to always wear a mask whenever possible and whenever physical distancing is not possible. If an amenity like a toboggan hill, playground, or dog off-leash area is crowded, please wait until there is enough space to physically distance or return at another time. And as a reminder, our outdoor rinks and our approved toboggan hills remain open. I remind you that toronto.ca/COVID-19 remains the best and most credible source of information for city residents and businesses. Thank you. I'll now invite Councillor Cressy to bring his remarks.
Well, thank you, Mayor Tory, Dr. Davila, and Chief Pegg. When it comes to this pandemic, there are some hard truths that we have to both acknowledge and confront. While all Torontonians have been affected by this pandemic, the hard truth is that some people in our city have struggled significantly more than others. 49%. Half of Toronto's cases have been people living on lower incomes. 79%. The overwhelming majority of Toronto's cases have been people of color. The truth is, COVID has exposed pre-existing inequities and challenges in our city. Precarious employment, a lack of affordable housing, access to health services. COVID didn't create these realities, but the pandemic has exposed and taken advantage of them. And so it's in that context that our task, in fact, our fundamental duty, is not simply to report on this data, but to correct these wrongs. Now, last year, our city and our Board of Health initiated Toronto's Equity Action Plan. It's a comprehensive citywide plan to protect residents hardest hit by the pandemic. In the fall, we told you about targeted measures, including making testing more accessible by repurposing city facilities and buses, and addressing testing hesitancy by funding community-based organizations to connect with residents. The Mayor has already gone through the results and the work in detail. I want to take a moment to speak to you about the work our city is doing with Toronto Community Housing. In recent months, TCHC has worked with Toronto Public Health, community agencies, and provincial healthcare partners to provide 13 pop-up testing clinics at their buildings. Significantly, TCHC has also worked to conduct 5 door-to-door testing programs at seniors' buildings experiencing outbreaks. More than 900 residents have been tested as part of this program. But here's what I want to focus on. The model developed here isn't just about bringing testing directly to people's doors. It's the outreach to encourage testing and to provide services to people so that they can safely isolate. It's this model that's innovative. So for each of these pop-up and door-to-door testing clinics, TCHC and local agencies, they went door-to-door in buildings, 3 to 5 days in advance of the testing. So working in multiple languages, outreach staff made phone calls, they dropped off leaflets, and they knocked on doors to connect with residents first. And they did this to ensure that people were aware of the on-site testing clinics to come, but also to connect those residents to the services that they need to safely isolate after the tests. Services like food hamper deliveries, prescription drug drop-offs, access to digital devices and Wi-Fi. And after the fact, TCHC staff conduct additional follow-up wellness checks with these residents to provide additional support they may need. You know, I labor on this point because this is the model we've been talking about for months. It's about making testing more accessible in hard-hit communities, but also providing the wraparound outreach and services to not only encourage people to get tested, but to support them to isolate safely afterwards. And so these actions we've described today, they're not the end point. We're nowhere close to finished yet. And even as the promise of a vaccine is on the horizon, we will continue to scale up, do more, and innovate further. As the chair of the Board of Health, I can tell you that tackling inequity and protecting our most vulnerable, it's both the right thing to do, and it's also just good health policy. We do this work because every resident of our city, every single resident, no matter where you live, where you work, how much money you make, every single resident deserves the protection they need from this devastating virus. We're not going to stop, and that's what it means to be all in this together. With that, I'll turn it over to Brad Ross to open up the floor for questions.
Thank you very much, Councillor. We will go to questions now. Just a reminder to please unmute yourself, and we'll go first to Mark McAllister from City News. Mark, go ahead, please.
Thank you very much, and congratulations on the outreach work that you have been doing. A quick question related to that. It's one thing to reach a number of people. It's another thing to get those people to those testing sites and getting a response rate. How successful would you say you have been or not been?
So, Mark, I don't have the specific numbers in front of me, but we certainly do know that bringing tests to people so that they have better access and making sure that they have a fulsome awareness of the opportunity and fulsome awareness of all the services and benefits that are available to them to address any concerns that they may have around implications of testing certainly does bring up the levels of testing and the levels of acceptance for those offers of help, support, and other opportunities. I don't know if you have specific numbers there with you, Councillor Cressy.
Well, Mark, I'll just draw your attention to the door-to-door testing that was done last week. This was done at a TCHC seniors building in North York. And so 3 to 5 days in advance of the testing, they went and knocked on doors and delivered multilingual outreach letters. The end result was on the day of testing, 220 residents were tested out of a building that has 266 residents. That's an outstanding result. And I think in a climate where we see that not only do people need testing, but in many cases, people are fearful of testing. If I test positive, will I be able to pay my rent? If I test positive, how will I isolate and get food or prescription drugs I rely on? That outreach in advance helps to ease people's concerns and to provide the necessary supports. And so those numbers there, 220 out of a building of 266 people, I think shows just last week that this new model works.
Thank you for that. A question to Mayor Tory. I know, Mr. Mayor, you did not get a question related to this, and you did speak to it at the end of your availability yesterday. So I'll pose a question to you this time about the Foundry site in the West Donlands. Councillor Kristen Wong-Tam was down on the site today, spoke about how community lawyers are now getting involved, but she also referenced how city solicitors are also getting involved and have supported the application in the course to try and get this demolition stopped. She said it's not just the fight of the community, but it's also a fight that will be taken up by City Council and specifically said by you as well. Can you comment on the fact that this is now being taken to the courts and your role in that?
Well, I would just say that I think, in fact, the city may be a respondent in this application simply because there's a number of laws that the plaintiffs, as I understand it, will be asking the court whether they should form part of the basis upon which an injunction would be issued to stop the demolition. In our own case, we certainly are very supportive of the efforts that are going to be made on that site to create more affordable housing. That's a very good thing for the city. But as I've said, when you are developing, doesn't matter who's developing it, whether it's the province or an individual developer, it doesn't matter whose land it is, when you are putting new developments into an existing area, you are impacting existing neighborhoods in some way, and consultation is important on many subjects, including, but certainly not limited to heritage aspects. And so we think it would be better for there to be that consultation for the studies that the province says it has undertaken, I'm sure they have, to be made public so everybody can see them. And so the court process will play itself out. There are probably ways in which some of this could be resolved outside of the court, which is always better. But we've made our views known. I've made my views known. And we'll have to see what transpires, either in or outside of the courts.
Okay, thank you very much. We'll go next to John Chidley-Hill from the Canadian Press. Go ahead, John.
Good afternoon, everyone. My first question is for Mayor Tory. Mr. Mayor, I understand that you spoke with Pfizer executives about the production issues they've had with their COVID-19 vaccine. I was wondering if you could tell us what that conversation was like, and if you got any reassurances from them that production is going to catch up, given that they're falling behind.
Well, I will not specify who I talked to. I think the best way to go about these kinds of conversations is to make your case as a Canadian, which I did, as the mayor of the 4th largest city in the country, and to try and make Canada's case. These are individuals that I happen to come to know in my life and my career prior to being mayor. And I will just say to you that I tried to make Canada's case, in a determined, thoughtful way, and I've kept the Government of Canada fully apprised of the conversations I've been having, because I'm trying to help the country's efforts to try and see if we can't get more supply. And I can't tell you what results my interventions or anybody else's will have, but I've tried to do it in a positive and constructive way, because I think that's the best way to go about trying to do business on something as sensitive as this.
As a follow-up to both you and Dr. Davila, how frustrating is it to have the city's vaccination programs have to be put on hold for an indefinite period of time as the city and the province and the country wait for the next shipment of vaccines from Pfizer?
Well, I'll start off, and Dr. Davila, of course, we can deal with the health-related aspects and any other aspect, but she can certainly deal with the health part, which I really can't. I will just say to you, I think in terms of the sort of psychology of the city, the fact that people view the vaccines as such a foundation for hope, the fact that it really does present us in a very practical way with the ability to move beyond the kind of lockdown phase that we've been in seemingly for a long time now. And so in that sense, it's very frustrating. It's frustrating for the business people who want to get back to business. It's frustrating for people who want to get back to work. It's frustrating for kids who want to get back to school. And it all, impacts on that. And that's why, I've been trying to help in any way that I can to see if we can try to find some help in this regard. Dr. Davila can perhaps certainly can address better than I can the health, I'll call it the health frustrations or the health impact that this has.
Well, if I can add further to that, I mean, clearly, I think we're all frustrated because we were quite hopeful and, as you can well imagine, eager to get on with an immunization program, recognizing that, we now have these vaccines, they've been approved for use, they're safe and effective, and they are, an incredible tool, if you will, in our toolkit against COVID-19. And so many of us have been working so hard at, trying to respond to this pandemic. We were very excited to have this new tool in our toolkit available for us to use, and certainly having it slowed down and having the change in course is not what we wanted, but we expect that there will be eventually vaccine coming available and that we will do our very best. So we're taking advantage of the time that is available to us now to ensure that everything is as ready as it can be, such that when the moment arrives that vaccine is more available and the supply is no longer a challenge, and we hope that that day comes sooner rather than later, but we'd like to make sure that we're as ready as possible. But in the meantime, we do know that it's distance, distance, and distance that makes the difference. We know what the self-protection measures are. I know it's frustrating for people, but we ask people to hang on. We are seeing, the benefits, starting to see the benefits of our collective action together. The more we can focus on those self-protection measures, the stronger we will be as a city and the more ready we will be for that day when the vaccines are available.
Okay, thank you very much. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi, thanks for this. The question first for either Dr. Davila or Mayor Tory, I guess maybe Dr. Davila first, is we're now in a 28-day lockdown that may be extended because of the high COVID rates. Now that we're seeing some decrease, can you talk about how that relates? What do we need to see that we could think about ending the current lockdown and reopening again? How far away from that are we? If this isn't a trend, what do we need to see?
So, David, I would start off first with that we do want to see sustained trends. We are hopeful when we see indications of improvement. But just as is the case with any, clinical or medical situation, you take, specific signs of improvement, with some caution. We know how very delicate a balance this is. And certainly, as there are new variants of concern with increased transmissibility as one of the characteristics, I think we need to continue to have a great deal of caution as we move forward, and we need to be very vigilant as a community, each and every one of us, in respect of those self-protection measures. I can't say enough how much it continues to be so important that people really limit their interactions exclusively to those with whom they live. Maintain that safe distance and a masked distance at that when you're out and about doing those essential activities that we all need to do, whether it's groceries or healthcare or getting some exercise. All those self-protection measures are what will see us through so that we can get to that point where we can, say that we're seeing real trends in the right direction, and hopefully aided and abetted by a more available and flowing supply of vaccines so that we can add that as part of our self-protection measures.
You know, David, I'll just say this. How many people out there have prescription bottles that have some pills left in the bottom, and they're now in a drawer in a cupboard somewhere? And yet the bottle says right on it, please take these until they're finished. And I think that our inclination as human beings often is to sort of say that as soon as things sort of feel slightly better, that you stop doing the things that, including taking the pills that got you to feeling better. And so again, the prescription here, keep your distance. Don't socialize with people that you don't live with. Wash your hands, wear a mask, avoid crowd scenes, and all the rest that we've been saying. And I think now is going to be the most important time of all. For us, if there are just glimmers of hope on the horizon, to see that through and not start making predictions about what day things are going to open or close, but rather just say, let's stay the course and let's get this done. And, you know, I think that there's every reason to believe we can get it done, but that's what it's going to take, is finishing the prescription.
Thank you. And then my follow-up, I guess, is for Mayor Tory. Premier Ford kind of came out swinging against Pfizer. Said that, you know, he doesn't accept the excuse that they need to stop production for a while to retool a plant, that it's not acceptable. You're having, it sounds like, more sort of quiet, maybe constructive. I'm not sure the tone. I obviously don't know what you said to the business people you know, but can you talk about that? Is it helpful to kind of be yelling at Pfizer, or what approach should you be taking? Because it seems like you're taking slightly different tactics.
Everybody has to, you know, make their own choices about that. I just felt that making the case as to why it was not only unfair and not only something that didn't seem to make any sense, but rather it was also, it was going to, you know, have an adverse effect on some of the efforts we had begun with respect to inoculating people in long-term care and so on, and with the second dose to come and all that kind of thing. And I think it was important because people don't necessarily focus in other parts of the world on what's going on in Toronto or Canada or Ontario. You know, I think that you also have to understand there are business challenges that these people face. If you think of the very challenge of producing billions of doses of this vaccine, there are going to be things that happen in the course of that, just as there are going to be things that happen to us in the course of rolling those things out to individual people in their arms. And so I've tried to, as I say, make Canada's case. I know the Prime Minister is completely engaged in this issue and is making all kinds of efforts to, again, put Canada's case and to understand some of the business challenges that these companies face. And you just have to hope that the combination of these efforts will produce some kind of positive result for our country. And we'll see.
All right, thank you. We'll go next to Lucas Meyer from News Talk 1010. Hi, Lucas. Go ahead, please.
Thank you, Brad, and congratulations, Chief Pegg. Congratulations. I guess the Mayor Tory and Dr. Davila, if you want to get in on this as well. Obviously, a lot of talk there on the testing efforts early. We've been kind of re-looking at rapid tests, and the ministry tells us that you know, they're looking at an 8-week pilot project for employers in healthcare, frontline, congregate settings. You know, manufacturing, warehousing, supply chain, et cetera. What do you want to see in terms of a city strategy, in terms of a rapid testing approach? What are some things, some examples?
So why don't I start off? I think that for us here at the city, and in Toronto Public Health in particular, we have actually had many conversations with people and advocated for the potential use of rapid testing in particular settings. So one particular setting, and we were actively working on a pilot on this in the fall, was within schools. So, you know, I think that when you look at the modalities of testing that are available, certainly we know that the tests that most of us are familiar with, that PCR test that you get done at an assessment center or perhaps through a pop-up testing center or mobile testing center, is very, very sensitive, which is great. It makes it, you know, an excellent tool to help us diagnose cases of COVID-19. When we talk about rapid testing, you do trade off a little bit. I mean, sensitivity is not as good, and ideally you make up for it in other characteristics, whether it is simpler to administer, more readily available to people, perhaps even less expensive. So it's a question of trying to use the various testing methods that you have available to you in the best way possible. So we have thus far undertaken some pilot efforts with rapid testing in schools in particular, but I can imagine that there might be other places where it could be deployed very usefully. For example, within the context of long-term care homes and visitors, perhaps, and in certain workplaces. Again, it all depends on the unique circumstances of the facility or place and the population that you're seeking to test, and making sure that you have all the protocols in place. But I think this is an example of using the available technology and finding the way to deploy those new technologies as smartly as possible, as efficiently as possible, so that we get to diagnosis sooner rather than later and can help people get to treatment as needed.
And so, Doctor, just maybe on a more even just kind of a simpler approach there, because you gave some examples on schools and long-term care. Until the vaccine rollout really picks up, do you think just overall the overall strategy around rapid testing, a more holistic approach with the lockdown, is needed for the next few months, where this has to be kind of an integrated, in a responsible way, as you mentioned, but in a specific, targeted, implemented way, you'd like to see a real kind of rapid testing structure?
Well, I think there are some discussions that are happening right now, and there are places that I can think of, and you can see where rapid testing would actually support some of our existing COVID-19 response efforts. But to my mind, until the vaccine becomes available, while testing, whether rapid or the more traditional methods, that's important. Testing is important. What's even more important, actually, are the self-protection measures. That fundamentally is what we can all do, right? No cost really required in terms of having to go get a test or to think about the right methodologies. To the extent that some of us are able to, really keep that distance, stay home as much as possible, work from home for those of us who have that luxury, only, socialize with people with whom you live, that distance, wear a mask, wash your hands. These are the factors that really will see us all through until such time as vaccine becomes more available.
Okay, thank you. Final question is to Trevor Dunn from CBC. Trevor, go ahead.
Thank you, Brad. This question is for the mayor regarding the First Parliament site. I know Councillor Cressy was tweeting about this earlier. I'd like to know what the mayor thinks. News today that the province is looking to expropriate the city-owned parcels of the land. I know we all want to see public transit built, but the site was described to me today as the size of Nathan Phillips Square. Significant planning has gone into it. I'm wondering if the mayor knows why the province needs all of that land just to build a subway station, and if he's going to let this happen.
Well, the point is that we don't know. And again, I think that, it can't be presented on the basis of either transit or the preservation of a site that has long been recognized as where Ontario's first parliament, ironically, was located. And so the notice of expropriation came, I guess we weren't necessarily expecting to receive it. We engage in ongoing discussions, and I think the whole point here is that as you go about making plans to build what will be a much needed transit station on a much welcomed transit line, that we have to sit down together in every one of these cases, whether it involves the land on Eastern Avenue for affordable housing, which we badly need, which belongs to the province, or this, a piece of land that we own, that they need to expropriate as part of the process of building transit, and understand what the intersection is going to be between the heritage, recognition that has been extended many years ago, the use of the land. Maybe it'll be a use of the land as part of a broader transit precinct that would be non-intrusive, but we just don't know that, and so this is what we're going to have to find out. And I think these are all lessons to us as to how we're going to have to sit together as two governments and, yes, get affordable housing built, and yes, get transit built, but do it in a way that involves proper consultation with the city, with the communities, and respect for all the various other policies that go beyond housing and transit, important as they may be.
Is it possible for that cooperation to happen if the province simply expropriates the land as it's seeking to do?
Let me just put it to you this way without discussing those two particular examples. I've had discussions with the Premier, and obviously a lot of what we're going to have to do to get affordable housing built, more particularly to get transit built, is going to involve the province taking actions, because they are the ones that have sponsored, paid for, and are overseeing these very big multi-billion-dollar projects, which will make a big positive difference to our city. But I've certainly emphasized to him, and he has taken it on board. It has not been something where we've been at odds on this, that is going to involve, of necessity, ongoing, meaningful consultation with the city in particular, and with, to some extent, the people who live in the city. And so I think he understands that, and I think maybe what's happening here is that these first couple of instances where we're seeing significant affordable housing developments, more significant than we've seen in this city for many years, done by us or the province or anybody else, and significant transit initiatives, again, more significant than done by anybody else under any previous premiers or mayors for a long, long time. There's some growing pains going on, and I'm not satisfied that we found the right formula in terms of consulting and being involved with each other in this decision making, and we're going to have to work at that, because I am not satisfied with the way these things have unfolded. He knows that, and the government knows that, because I've been in touch with them, and we're going to have to do better, both of us.
Okay, we do have one more question from Chris Dunseith. I'm sorry, Chris, our very capable camera operator here from Global News. Chris?
I guess for the mayor and for the doctor, for a reporter that's in Peel Region today. Peel Region seems to disclose more names of businesses with and without outbreaks in the region. Is it something that the city should do more of, is name businesses in particular that are not in compliance, that have had outbreaks, so that the general public can know more information about that? Should there be more that we do to name businesses both in outbreak and with outbreaks?
Well, I will simply say, and Dr. DeVilla will give a more complete answer, that I think the answer to that question in terms of our commitment to and our view as to the desirability of a greater level of transparency was evidenced by an announcement we made 3 or 4 weeks ago to move precisely in that direction. And it was subject to, obviously, to legislative and other kinds of criteria that you would apply to making sure you make those decisions about disclosing things carefully and certainly in compliance with applicable laws, but that the direction in which we were moving was certainly one of greater transparency. And on that note, perhaps I'll ask Dr. DeVilla to elaborate on how that's going.
So the mayor has it quite right. We are working towards that. We had a recent Board of Health meeting, and there is an interest for sure in having more information in order to inform the public around what the circumstances are with COVID-19 in our community. So that is something that we are actively working on right now. Our Board of Health meeting was just on Monday of this week, and we anticipate having greater detail to share with the public in respect of workplace outbreaks in the next week or so.
And perhaps, Chris, if I can just add, the Toronto Public Health's policy of weekly reporting of workplace outbreaks every Thursday, both broken down by 11 categories, as well as identifying outbreak locations, is amongst the most transparent in the country. In fact, the entire reason this policy is in place is to ensure transparency, to inform the public and in turn public behavior, but also to ensure workplace safety. And so that's the ongoing work that Toronto Public Health has demonstrated, not just in workplace reporting, but in the reporting you've seen today on data related to race and income and housing status. That in all these areas, I think it's fair to say that Toronto Public Health is amongst the most transparent, in fact, in the country.
Thank you. Just to follow up to an earlier question, I'm told, excuse me, by TCHC that since June of 2020, 1,386 TCH tenants have been tested. So just an added number there. So thank you very much. And congratulations, Chief, on a well-deserved recognition. I can tell you that your leadership has been very much appreciated and unwavering since all of this. So congratulations, sir, and thank you all for joining us. We'll be back here next Monday with a further COVID-19 update. Stay well.